and welcome to another edition of Health Matters. Because your health matters, we are committed to bringing you quality programming under a variety of topics to bring you information. And guess what? You know what's coming. That information is only powerful when you act on it. Hi everyone, I'm Anna Marie Sinatra from Sinatra Solutions, your coach, consultant, and trainer. And you know I'm going to start right off the bat with one of my favorites. It's that cute little cartoon where the doctor is standing over his patient and he's saying, "We finally figured out what's wrong with you. You're allergic to your own negative thinking." Well, you are certainly going to find out why today that is so apropos. We are going to hear from Dr. Jeffrey Lackner and Dr. Leonard Katz at the Behavioral Medicine Clinic. But before we do, let's hear from our sponsors who help bring this program to you in part.
Hi, I'm Joe DeMarco, founder and volunteer pilot for Wings Flights of Hope. At Wings, we know that health matters, and we are there to transport people when they need to travel for their medical care. We often see people that need to travel to other cities and get the best care that's available. And that's the purpose of Wings, is to never have transportation to ever stand in the way of someone receiving the best medical care available. Keep watching Health Matters and learn about all the things that are available to help people for a better life.
Electronic Merchant Systems is proud and honored to bring you such creative educational television as Your Health Matters. We believe in we educate and you decide.
Hi, I'm Michelle Giambardino from Face Fitness Skincare, a proud sponsor of Health Matters. We take pride in educating you on anti-aging solutions to help you obtain healthy, glowy skin. Continue to watch because your health matters.
Thank you, Dr. Lackner and Dr. Katz, for having us here today. I am so excited. You know, I've done my homework. I've been on your website and have read all of your brochures and your information. And I'm so excited about sharing this very important information with the community.
Thank you.
Yeah, so tell us a little bit about the Behavioral Medicine Clinic.
So the Behavioral Medicine Clinic is a nationally known clinical and research program that's really devoted to studying and treating chronic, painful medical problems that haven't fully or adequately responded to standard conventional treatments like medications, surgery, and so on. Clinically, we treat a variety of different medical problems, including low back pain, non-cardiac chest pain, TMJ, fibromyalgia, and abdominal pain and headaches. And then we have a very large research program that has been funded continuously since 1999, and that's really focused on developing and testing non-drug treatments for a medical problem called Irritable Bowel Syndrome.
This, you know, you've said so much, and I just want to unpack all of that because that is such important information. And I first heard you mention, and it was in one of your beautiful brochures that explains so much the difference between chronic and acute pain.
Right. So, you know, pain is described in different ways, and one way we describe it is in terms of how long it lasts. Acute pain is pretty straightforward. There's an injury and there's pain. And the relationship between that injury and the pain someone experiences is it goes hand in hand. The bigger the injury, the bigger the pain, and the amount of pain that you have is due to how much physical damage the injury causes. The window for acute pain is about 3 to 6 months. And after that period, after that window, you have what is called chronic pain. Chronic pain isn't acute pain that just won't go away. It's a chronic condition. It's really a condition in its own right, that it's influenced like other chronic conditions by a host of biological, environmental, personal factors, all of which kind of interact with one another to influence pain.
And so many people suffer, whether it's from a car accident or a traumatic injury, if it's a fall or different things. And that pain not only affects how they are physically showing up in the world, let's say, but also that mind, body, spirit connection. And that's what you're really, the mind and body connection is so prevalent here.
Yeah, I think it's a little bit like throwing a stone in a pond. Long after the stone hits the bottom of the pond, there's a ripple effect that can affect almost, every aspect of someone's life, from how their physical well-being to their mental well-being to how they perform activities, intimacy with their partners, the way they process information and their outlook, a variety of different factors. And so it's a very complex problem, and our goal is to try to help patients gain some control over that pain that isn't responsive to medications and other treatments that work for other types of pain.
When you're speaking about this, it's so exciting to me. I want to hear more, even on a personal level, after a very major car accident. Sure. Most of my viewers know. And I elect not to take medicines. I'm holistic, yeah, and I use acupuncture and color and light and massage and, just about anything that I could try, I try. And with the blessing of this program, I've been able to interview so many people with different modalities. So I think I might want to even talk to you a little bit more later. Sure. Myself. Where's that number that we call? Absolutely. Because one of the things that I noticed too, and I think I'm more compassionate with people that when I see them going through it, is how irritable I became when I was in pain. That chronic pain, or the chronic pain, right, or is it the acute? So I'm getting confused. The chronic pain, that lasts longer, yes. That chronic pain, when you're always in it, can make you irritable and not really act yourself.
Well, or maybe it changes the way we ourselves. I mean, I think that pain influences, as we said earlier, a lot of different aspects, and emotions, whether we're talking about depression or anxiety, anger, don't really cause pain, but they can kind of crank up the volume on pain, and they can decrease our tolerance for painful stimuli. So it's not surprising that we become less tolerant of frustrations and more irritable.
And during that time when my pain was chronic and very difficult to manage, my blood pressure went up too. I had skyrocketing blood pressure, and they said, if you don't do something, we're going to have to put you on blood pressure medicine, because I wasn't exercising either. Well, and I said, absolutely not. So I had to work on that. That's why I'm so interested to bring in the evidence-based research too. We're going to move to in a moment or two, because I really worked with meditation and different ways of managing that pain, so that I wouldn't bring that blood pressure back down.
Well, I think that where your experience and our work is similar is that some of the disorders that we treat, whether we're talking about irritable bowel syndrome, migraine headaches, tension headaches, TMJ, low back pain, they're problems that don't lend themselves to a simple cure or fix. And so the day-to-day burden of having those problems really is on the patient's shoulders, and no one really learns when they're, how to manage a chronic illness. We probably spend more time learning how to, program a DVD player, but when you have a chronic illness, no one really, formally teaches people to what kind of skills you have, even though we know that the ability to cope with and control chronic conditions really comes down to what kind of skills people have. And that's our role, is to teach patients very practical, concrete skills to manage, control painful medical problems.
Wow. Wow. This is so amazing to hear you talk. It's the way that I felt all while I was doing my research for this program, is that the show is all about, educating people to be proactive with their everyday lifestyle. Not just sit back and just the old way of just taking a pill or expecting the doctor to magically cure you or a pill to magically cure you, but to get information, to be educated, and then get proactive with your own health
Well,
care.
this may be a good time for me to express, I'm a gastroenterologist, and I've spent my career in gastroenterology and became aware that there was a very significant proportion of patients who go to see a gastroenterologist who do not have condition that can be identified by physical abnormalities, and began wondering, this is long ago, what was going on with these people. And it turns out it can be categorized with a very complex way of categorizing. One of the most common certainly is called the Irritable Bowel Syndrome.
Yes.
And that Irritable Bowel Syndrome is one of the most common health conditions that we know of. Way over 10% of adults have some form of the Irritable Bowel
Wow.
Syndrome. And it's not going to be managed by finding an abnormality. It reflects what Jeff Lackner was just talking about in terms of how the individual relates to, connects to what's going on in their body. It's a true mind-body connection that produces a set of symptoms that can be very severe.
Wow. So for our viewers who are watching today, what kind of things might be going on with their health that would make them or invite them to call you? What kind of things would you do with them? How does this work?
Well, so you know, the decision, I think that, as Dr. Katz was saying, irritable bowel syndrome is very common, and it kind of ranges in a spectrum between symptoms that are mild, not particularly disabling, and more of kind of an inconvenience and not particularly frequent. And then there are people that have more moderate and severe symptoms, and those people have symptoms that, you know, maybe occur a couple times a week, and they really start disrupting activities of daily life, socializing, performing recreational activities, how they kind of see themselves, their own body image. I think that the people that we see have symptoms that finally takes a toll, that it's not something they just kind of grin and bear it, but they actually, they've kind of been fed up with those problems, and their quality of life has really suffered. And by quality of life, their well-being, their ability to perform activities, get the most of their life. So I think when when you ask what prompts people to get help, I think it's really the kind of the severity, the unpleasantness of the symptoms, coupled with their impact on people's day-to-day lives.
And maybe just to emphasize in terms of the symptoms, gastrointestinal symptoms are very common in terms of constipation, diarrhea, but a central feature of the irritable bowel syndrome is pain. Some degree of pain, ranging from moderate to modest to moderate to really very severe.
So is there a way that it's diagnosed too once they come to you?
Well, I think this is one of the striking aspects of the condition, that it needs to be recognized for what it is, because all the diagnostic tests that are out there currently available in terms of endoscopies, x-rays, what have you, do not diagnose irritable bowel syndrome. Irritable bowel syndrome, in order to be diagnosed, requires a real interaction with the patient to understand what's happening in their lives, how often it happens, what sorts of events are likely to trigger those events, and how severe are they. Then you can really begin to understand that fits, certainly within the research perspective that Jeff has led now for a number of years, looking for trying to help those who have the more severe reflections of the condition.
I think that it used to, irritable bowel syndrome is the diagnosis has undergone changes. It used to be considered kind of a wastebasket medical problem, and if you didn't have this disorder, or that disorder, or that disorder, then physicians finally said, well, you must have irritable bowel syndrome. That's a
kind
cost.
of at the end of the line. Well, you don't have
Can't figure
anything
anything
else, so maybe that
Must be that.
Which is not.
That's costly, that's expensive, and oftentimes painful. And I think that over the past 15 years, there's been a lot of advances where now people, physicians like Dr. Katz and other gastroenterologists, now are able to kind of to confirm that you have irritable bowel syndrome on the basis of very specific symptoms. So you don't have to go through needless tests. You don't need to spend a lot of money on physician visits, but you can go to a doctor who actually can confirm that you have IBS with relative, confidence, and you don't have Crohn's disease or colon cancer. And I think that's been a really important advance in our field.
And one of the things that I really liked about the information when I was reading, you said evidence-based research. And I'm hoping you're going to bring in the MRI scans and talk a little bit about that and how that the mind-body connection works.
So much of our work over the past 15 years has been developing non-drug behavioral treatments. And as I said earlier, we've been funded continuously by the National Institute of Health since 1999, which is a remarkable, track record, and I think speaks to the quality and impact of the type of work that is done at the Behavioral Medicine Clinic in the Department of Medicine at UB. Our current work is focused on developing treatments that are brief and effective for the majority of patients who have really severe and long-lasting symptoms. I mean, the average amount of time that our average person has IBS is about 14 years, which is a very, very long time, and these people have very severe symptoms. So we're interested in developing treatments that are effective, but we're also interested in developing treatments that can be efficiently delivered. And so we've spent a lot of time over the past, 8 years developing brief treatments. More recently, we're interested because we see people actually who undergo our treatments reduce the severity of GI symptoms. We're interested in understanding a little bit about what is the biological active ingredient for our treatments. And so, in addition to our large grant, we recently got a grant with Northwestern and UCLA, which are leaders in the world in this area, and to look to have patients undergo fMRIs, which are basically pictures of the brain before and after treatment. And the goal is, can we identify, can we see that patients not only improve their symptoms in terms of what they say, but do we see a corresponding change in brain activity? That is, can patients not only learn skills, but in the process of learning skills, are they able to kind of recalibrate the wiring that goes from the brain and the gut, which is very exciting. The idea that patients can actually change the way they not only respond to stress and reduce their symptoms, but actually change the way their brain reacts is really exciting.
You can tell this is exciting news because we're both ready to jump in. Yes, Doctor.
It may be worth saying, and Dr. Lackner is implying it, that among the new information that we understand about the human brain, we may have thought of it at one time as just a kind of like a cantaloupe, as something that is fixed. It is by no means fixed at all. It is continually changing. It's going through both physical changes, wiring changes, and they can now be identified with the high technology available to see some of those changes. So what's going on here is saying, in those patients that we see who show some symptom reduction, can that symptom reduction be seen or correlated with changes in the brain?
Wow. And that you evidenced in the MRIs.
Absolutely.
Right.
You have any idea, as a coach that works with people's brains and how they're thinking and seeing and perceiving the world and the people around them, and some people just feel like they can't change, you know, how exciting this is to me, because I'm always introducing little tips and ways and ideas of how to change the way you think. You know, one of our greatest thinkers said, when you change the way you look at things, the things you look at change. And I love that one. I love that one.
Well, I think relatively recently, these studies, because of their expense, would enlist about 20 subjects, and our current fMRI study will be recruiting about 130 people that will have brain scans before and afters, which makes this one of the largest studies of its kind. So we're really excited about how that's going to not only impact patients' lives, but also contribute a lot to what is known about this very difficult problem.
Oh my goodness, this is so exciting.
Maybe I can expand the thought involved. It's really kind of remarkable. And as a physician, I would speak about this. We've been accustomed historically to think about making things change by you cut something out, or you make some big change.
Right.
Or you give big drugs and medications to make them change. And here we're in the midst of seeing, and I see it by talking to patients on a periodic basis, dramatic changes in what can often be very severe symptoms. And the question is, how does that happen? How does that happen by learning, by understanding? Does it change the physicality, the actual physical symptoms?
Wow.
And how is that, and can that be reflected in the brain?
Do you think we can do something together? We can take some of my clients that are trying to be either better leaders or better employees at places and scan their brains to show this stuff really works. This is just so exciting, and I am feeling so honored and privileged to be interviewing you both, because I feel like this is going to be groundbreaking, amazing information that's going to change the way that we look at medicine.
Well, we feel like it will contribute to what is known about a very complex, for the most part, poorly treated medical problem.
That's very modestly put.
And the hope is, I'll set it at a little broader frame, and the hope is what's being learned here in Buffalo, New York, will have the ability to be disseminated, passed on. We're not the only center doing this, but to be passed on to other places so that it can be implemented once it gets to be easy enough, if I can put it that way, into a kind of a way that it could be transmitted to many other places.
Oh, absolutely.
I think Dr. Katz brings a good point. One of the things that we're really proud of is that the treatments that we're featuring in our work were actually developed and tested through fairly rigorous clinical trials. And so we didn't kind of bring those from, Yale or, Cornell, but we actually developed those here in our backyard. And so for the people in Western New York, this is a really wonderful opportunity to get state-of-the-art treatment that is really not available. I mean, I was actually just on the phone this morning with a fellow who has very severe IBS in Brooklyn, and was looking for, he saw an ad that we had and he called and was looking for somebody to provide the type of treatment. Now, he lives in New York City, and I was hard-pressed to provide him somebody who could deliver our treatment. And the people in Western New York have this treatment. It's for Irritable Bowel Syndrome. It's free of charge, and it's state-of-the-art. So it's a really great opportunity for people in Western New York to get relief that is not really available elsewhere.
I cannot tell you how excited I am. I'm going to be plastering this after it airs on Time Warner, of course. My contract with them says so. Then I'm going to be plastering this all over social media.
It still is a research
Plaster
project.
away.
I am happy to do it because I want you to know about this. And I'm kind of thinking irritable bowel syndrome is one thing that I haven't had to go through, but there's been so many accidents supplements and different things. Not so many, but a few. And so I definitely, before you scoot out the door, I'm going to find out about some back or shoulder and even the fibromyalgia. I have several people that have asked me, do you know anybody, what doctor? Because people come all the time and ask me for information or referrals.
I'll turn this back to Jeff, but I just would like to say that it's become clear that a variety of pain patterns may share some of the same characteristics, so that it is possible to change the way in which the being, the brain, the total being, responds to that in the same way that they respond to the real pain of the irritable bowel syndrome.
Wow. Wow. Time has flown by and we just have a couple minutes left, and I want to be sure that you were able to get out everything. I don't know how we do that in just 28 minutes or 26 minutes, but is there anything left that you want to be sure you get in today?
I think Jeff wanted to be sure.
Well, as I said earlier, I think this is a great opportunity for people who have irritable bowel syndrome symptoms, whether it's abdominal pain with diarrhea, abdominal pain with constipation, or abdominal pain with diarrhea that alternates with constipation, to get state-of-the-art treatment. And we're looking for volunteers between the age of 18 and 70 to take advantage of this really exceptional state-of-the-art program.
It is so exciting. It's so exciting. And so I hope you did have those pens and papers and ready, and you were writing lots of notes and took down the website and the phone number, and that you'll call Dr. Lackner and Dr. Katz and find out more, because we're always talking about the information only gets you so far. Unless you act on that information, you're going to be dead in the water, right?
Yeah,
so I hope people reach out to you. I know, as I said, I definitely want to talk to you some more about a few different things.
Thank you for your help.
Yes.
It was great.
And I hope maybe we can get you back on here again
Great.
soon.
Thank you very much.
You're welcome. Who knew we had such an amazing resource in our own backyard? I absolutely love hearing from you, so keep your emails coming in, and I love hearing you and your comments on Facebook and sending me information about who you'd like to see on the program, and maybe it's even you. So make sure you visit YouTube and put your comments on there, and until next time, remember, your health matters. And stay tuned to hear just a word from more of our sponsors. Your Health Matters Minute with Anna Marie Sinatra from Sinatra Solutions. Think about what you're thinking about right now. Stop and notice your thoughts, because your thoughts become words, your words become actions, your actions become habits, and you might be stuck in a rut. But the good news is you can change it. How? By stopping and noticing what you're thinking. Stay tuned for more golden nuggets to learn how to take that thinking and switch it around so you can create success everywhere you go.
Hi, I'm Kimberly Will from Mr. Frank's, and I'm a proud sponsor of Health Matters, and I am very motivated and inspired by all of the information that the show offers.
Thank you, Matthew Sauer from Mattress and More, who helps to keep this program on the air. We appreciate your sponsorship, and we also appreciate you educating us on the importance of what we're sleeping on for 8 hours a night. Your health matters, so stay tuned, keep watching, and email us to let us know how much you appreciate all this great info.